My name is Judy Brueck. I recently retired here after being a nurse for 50 years in the healthcare system. I worked in the healthcare system for 20 years as a hospice nurse. What brought me here was the fact that I knew the hospice healthcare system from here. I knew a lot of the nurses, and I had great faith and believed very much in hospice care. My husband was a patient after a fall and was in skilled care, no longer could progress due to his excruciating pain. He worked construction, in fact, owned his own construction company for so many years that he just had generalized pain that got worse and worse. And he got so he couldn't walk except with a walker. And then finally, when he did fall and break his hip, that was kind of the downhill slide of it all. The team decided that he should be moved to long-term care. But moving him with a lift even caused him such excruciating pain. Lifting his arm to eat caused him excruciating pain. So the goal then became giving him pain-free time and days with his family. It soon became the goal for the two of us because we had talked about it. When he became not so lucid, so I knew that it was okay with him, and we changed him then to hospice care. My husband was a very dignified man. He was 85 when he passed, played 18 to 36 holes of golf a day up until the time he was 80, worked in his business full-time up until the time he was 80 and began his decline. Preserving his dignity was very important, and it was so hard for him to have people to come in and do the personal cares. He knew it had to be done that way. I did them at home, but that was different. His final hours were the best ever, I would have to say, in probably months. He loved music, but couldn't enjoy it very much because he was always in so much pain. He sang barbershop for 50 years. So one of his daughters brought in an Alexa. He learned how to use our Alexa at home. So it was around midnight and turned him and started playing Percy Faith. That was his favorite. Scooted him over and I snuggled in with him. 4 o'clock, she gave him his last pain med. 4:30, he opens his eyes, looks at me, and he was gone. With dignity, respect, and no pain. And I said, the end. It was perfect. I mean, you couldn't have written a better script. You couldn't have written a better book. And to me, that's what hospice is about. And I think if more people understood that it's not about you're going there to die. Well, yes, that's going to happen. He was going to die no matter what. But how you die is what's important.